I'm going to turn it over to Dr. Natalie Pageler with Stanford Medicine.
Thanks, Roseanne. And yeah, a very impressive presentation so far. And I'm so excited to be part of this panel. I'm going to be taking a little bit of a turn and focusing on both children specifically and families and from an informatics technology lens. So as mentioned, I'm the inaugural Division Chief of Clinical Informatics in the Department of Pediatrics here at Stanford and have served as the Chief Health Informatics Officer at Stanford Children's for the last 10 years. Next slide, please. So I think you know a little bit about Stanford Children's, but just to give you an idea of the numbers and our organization, at the center, we have our Lucille Packard Children's Hospital, but we also have more than 60 clinics that are spread across the Bay Area, dedicated to serving children, families, pregnant women, and couples that are seeking fertility care. We see over 700,000 outpatient visits a year, deliver 4,800 babies a year. And as you can see, have a very diverse set of expertise. Next slide. What I am focusing on today is just talking about how exciting this particular era is and the role of technology in clinical informatics. So for those of you who aren't aware, clinical informatics is a medical subspecialty now that's focused on how we implement our information and communication systems to improve patient care, enhance access to care, improve population health, and strengthen the clinician and patient relationship. And so when we're talking about information and communication systems, that can be anything from, rolling out the electronic health records 20 years ago to really reaching out to our patients and families and engaging them in their care through our patient portal and health information sharing to, of course, these days, thinking about AI and how we safely, meaningfully, and equitably implement AI for our children and families. Next slide, please. So we have a very well-developed clinical informatics department at Stanford Children's and digital information services that has been rolling out these communication systems for many decades now, but there are some really interesting and unique perspectives on children and families that deserve extra attention. And so we are really partnering our operational teams with our academic teams to make sure that we fully understand the implications for children and families. And so just to highlight a little bit of that, as we think about engaging adolescents in particular, they have very unique needs and also unique vulnerabilities. And thankfully, in California, we are lucky to have a strong regulation around supporting our teens and protecting their privacy, but that gets very challenging to do technically. And so our research teams have looked at how we can set up our patient portals to both engage teens as well as their families and make sure we are fully empowering them. We are using things like large language models, ChatGPT, and evaluating how those may be applicable in the pediatric space and how they may support some of these unique technological challenges, and then evaluating things like our patients and how our patients and families perceive AI in the clinical space. Next slide, please. Our division is also very focused on educating the next generation of clinicians and healthcare providers. And so we know that education and medical practice is rapidly changing. And so we want to make sure that the future healthcare leaders are fully educated about both the technology, but the people and process aspects that go along with that. So we have one of the oldest ACGME approved clinical informatics fellowships in the nation. It's now over 10 years old, where we train physicians who have already been board certified in their primary clinical specialty to understand and learn about all the details of the technology that is implemented in the healthcare systems, as well as the leadership skills, the change management, the project management, the people and process aspects that they need to safely and meaningfully implement these systems in the healthcare. Next slide, please. And then finally, we also see it as our important responsibility to make sure that we are advocating locally, regionally, nationally for important regulations and technology development that will serve children and families. And again, there's some specific aspects of pediatrics that aren't necessarily well served by traditional technology. So we are on a wide range of both pediatric organizations, as well as partnering with some of our vendors to make sure that they are incorporating pediatric specific builds, as well as making sure that national and local legislation, for example, the 21st Century Cures Act that mandated and empowered sharing of health information with patients and families, that was done thoughtfully for children and families. Next slide. And so just as a final kind of a cute example, but actually very powerful and meaningful, we always joke that babies aren't born with cell phones, and yet the electronic health record, when it was set up to capture a patient's name, date, birth date, address, email address, and cell phone. And of course, what goes into those fields when a baby is born is often the mom, dad, grandma's information. You don't know necessarily who it is. And that leads to all kinds of downstream implications, because that's tied to how we communicate to our patients and families. That's tied to how we set up our patient portals. It leads to confusion about who we're reaching, what language they may speak, and privacy breaches for especially our teens and young adults. And so we, with our operational teams and our research teams here at Stanford, redesigned our EHR to better serve children and families, but we also partnered with our vendor, Epic EHR systems, and got them to change that globally so that we can better serve children and families across the world, that we're better communicating and empowering them. So that's all I have for right now, but look forward to the conversation. Thanks for having me.